Cancer is a continuously growing global health problem that poses major challenges, most especially in developing countries. Find out how this international distributor of innovative health products came up with a series of solutions to help increase a patient's chance to survive the odds. In 2020, the Philippines hit a record of 354,398 prevalent cancer cases within a 5-year period. But because of poor access to health care, especially for people living below the poverty line, the advances and breakthroughs in cancer remain unattainable to many.
Cancer refers to a group of diseases that's characterized actually by cell growth, abnormal cell growth and proliferation, inflammation, as well as angiogenesis or formation of new blood vessels. It always starts with mutation in the genome or the genetic makeup of a person inside the cell. Before PPARs, most of my patients, they were unable to finish the chemotherapy regimens because of the side effects and because of discomfort during the process of chemotherapy.
Maria's son Dominic was diagnosed with stage 4 rhabdomyosarcoma when he was only 4 years old. While coping with the recovery of her other sick child, Maria found it hard to accept Dominic's condition.
It was actually very devastating kasi with Dominic, it was manifested mga 4 years old na siya eh. Unlike dun sa daughter ko na congenital talaga, baby pa lang. Yung mga bandang September, meron ng umuumbok-umbok dito sa leeg niya. Hindi ko talagang iniisip na cancer kaagad siya until nag-nosebleed siya.
Dominic was prescribed chemotherapy, but his family insisted to rush to an integrative doctor to seek for alternative cure.
Medyo hesitant ako kasi as a mother, I know the side effects ng chemotherapy kasi. So what I did is that I rushed towards the integrative doctor of my daughter, who happened to be PPAR partner doctor of Simply Nature.
One of the hardest decisions to make for people living with cancer is choosing the kind of treatment that would work best. To help patients and their families deal with this growing health problem, one company commits to producing safe, credible, and natural health solutions by drawing on the latest bioscience technology to deliver a series of safe, efficient, and natural products. What is Simply Nature and what does it do?
Simply Nature is a company we created and founded about 10 years ago. Our mission is to find effective health solutions for people. So we provide natural products that work in combination with conventional therapy and medicine.
As an international company that provides natural solutions for cancer, metabolic syndrome, and degenerative diseases, the management upholds a health philosophy that centers on whole food nutrition as the frontier in health management.
When we talk about choosing treatment, especially in the area of cancer, patients are really afraid of chemotherapy because of its side effects, and they tend to then look towards natural products. But this is not a either conventional or natural choice. At Simply Nature, patients can have the best of both worlds. Our protocols work with conventional chemotherapy to minimize its side effects so that they can get the best treatment using both conventional and natural together.
Cancer is like a virus. It continuously evolves, it mutates. So it can develop defenses against our usual treatment modalities like chemotherapy.
Like I said, chemotherapy and radiation therapy have a lot of side effects. So more often than not, patients stop their treatment because of these side effects. It's very important to have the support.
With the supplements that we give the patients, there will be lesser side effects, so they will be able to finish their chemotherapy protocols more comfortably.
This company introduced PPARs, which is touted as one of the best natural ways of solving serious health problems.
PPARs stands for peroxisome proliferator activating receptors. It's basically a nuclear receptor found inside the cells. Now, when these receptors are activated, the benefit that you can get from that is, number one, cellular differentiation. Number two, it's to promote fatty acid metabolism. If you have better insulin function, your blood sugar will naturally go down. And another one is to induce cancer cell death by modulating the immune system.
As a sole distributor of PPARs, the company promotes its use to many reputable health institutions worldwide and actively organizes corporate health conferences and public health talks in Asia.
Simply Nature PPARs is made out of a special strain of these types of microalgae that is very effective by protecting the bone marrow. We maintain the integrity of the immune system of the patient, which is very important to prevent infections and to fight off the cancer itself. And also, Simply Nature PPARs is also very dense in nutrients so that the patient can recover faster because of better cellular healing.
Sabi ko parang na-lead kami to an extraordinary and I must say amazing journey. I'm very proud of him. At a young age na 8 years old, he believed that it's his purpose to siguro encourage other people then. We would like to really pay it forward with the knowledge that there's really like Simply Nature that can help people with cancer very much.
When fighting cancer, living healthy is very important because it allows us to pursue what is important to us in life, and that's what it's all about. When we can help a patient move from being bedridden to getting up, to be lucid in thought so that they can have conversations with their loved ones, it gives the whole process of fighting cancer a whole new meaning. And that is what drives us at Simply Nature.
So the doctor took out his video stroboscopy and he looked at it, and then when he checked it, he said, "Oh, seems like it's gone." He pulled out the camera and checked it again. And they were saying, "I think it's gone. The cyst is gone. Your vocal cords are looking great. What did you do?" Then he pulled out it again and checked it again. He sat down and said, "It's gone." Hi, my name is Nesta Vicencio and I'm 32 years old. I'm an insurance agent, so I'm in sales, so you could think of I've been talking a lot, and I regularly sing because of ministry. So I sing on Sundays, so I use my voice a lot. Starting January 27, I started losing my voice, and then the hoarseness remained for more than 2 weeks. And this started bothering me, like what's going on with my voice? It's taking too much time. 2 weeks and a few days, I decided to see my ENT doctor, and he diagnosed me with chronic laryngitis. And then, for the first meeting, he asked me to take steroids. The point is to remove inflammation. So he's saying that probably I have throat inflammation because of voice use. So fast forward to taking the steroids for a week. I've been on voice rest, and whenever I test my voice, the hoarseness is not going away. I'm still strained. Whenever I try to talk, it gives me pain on my neck up to my head because it feels like I'm using head tone every time I try to produce sound. So I went to a different hospital, and a different doctor did the video stroboscopy to see what's going on with my voice box, my vocal cords. And when he did that, I already felt nervous about what I'm seeing on screen. And then when he started saying that you have a vocal cyst and the only way for this is to undergo surgery, tears started falling down my face and I just couldn't help it. As someone who uses my voice every day in everything that I do, in my work, in my ministry, talking, singing, it's like too much for me to take. I asked for the recovery and the doctor said, for now, you need to go on voice rest to remove the inflammation. Take the steroids to remove the inflammation. Once you're cleared, then you can go for surgery. And that's the only way. I said, so if I will have vocal surgery, will it affect my voice? Then they said, you will be able to speak again. But as for your singing voice, we have no assurance for what will come out. Honestly, after the 5 doctors, it felt like, okay, there's no other way but surgery. And then one day, our good friends, Sister Jazz and Pastor Shyan, they introduced me to PPAR's extract. This product helps with cysts, tumors, and it helps, and it's all natural. So for me, what would I lose by taking something natural and non-invasive and something that's recommended by people I trust, people I love? So I said yes to them because I'm at the state where I really want another option other than surgery. So at first, they recommended me to take the PPAR's extract liquid, which is a liquid form of PPAR's, and they asked me to take it for 3 days. Then after that, they gave me PPAR's extract powder. And then after 2 days or after 2 vials of PPAR's extract liquid, there was a morning that I forgot that I'm on voice rest because I just woke up. So I just woke up and greeted my husband, and my husband was like, "Why are you talking? You're supposed to be on voice rest." And we were both like shocked that, "Oh, I'm not supposed to talk." And then he said after, "But baby, your voice sounds better. It sounds normal." So I tested my voice again and said another line. And we looked at each other and said, "It sounds normal." And this time, it's just on my second vial. After 5 days, so 3 days vial for the first 3 days, and then on the 5th day, on the 4th and 5th, I'm already taking the powder of PPAR extract powder. So I got so excited and curious, so I went to see my doctor. I will never forget this moment because when I entered the room, my doctor said, "So what's your plan with your life? When are you going to do your surgery?" And I was like, "Oh, doc, I'm done with taking the steroids. I'm done with my voice rest. I've been on voice rest, strictly doing it." And then when I was talking, my doctor said, "Is that your normal voice?" And then I told him, "Yeah, it is my normal voice. Does it mean I'm okay?" And then he said, "Well, of course, probably because of the steroids," which I didn't tell him. Before taking PPARs, I decided to throw away my remaining steroids tablets because I've read about it. It's not really good. So on my own, I decided to throw it away and start taking PPARs. And then he said, "Oh, probably it's just the steroids because the inflammation is gone. That's why you're back on your normal voice." I said, "No, the cyst will not go away on its own. So it's probably the voice rest. So come, let us check it." So the doctor took out his video stroboscopy and he looked at it, and then when he checked it, he said, "Oh, seems like it's gone." He pulled out the camera and checked it again. And he was saying, "I think it's gone. The cyst is gone. Your vocal cords are looking great. What did you do?" Then he pulled out again and checked it again. And then that's through the mouth. And then he said, wait, one more time. I'll just try it through the nose." So the doctor, who was supposed to finish our appointment, said, "Oh, one last time. I just want to see it one last time." So he tried it through the nose. And he checked through the nose. He said, "It's really gone. Oh, can you tell me everything that you did? I need to document this. Is it okay if I write a report about your condition? Because the cyst is gone." And then he said, "Oh, maybe I will see you in 2 months. Just come for a checkup. Let's see what will happen. But you can continue with voice rest. Don't get too excited." So I'm really, really grateful that I got introduced to PPAR's extract, the liquid and the powder.
So Simply Nature PPARs actually have very strong anti-inflammatory properties and anti-inflammatory nutrients. So with Nesta's case, being her voice box is inflamed, no? Which eventually led to her vocal cords developing cysts. With less inflammation inside Nesta's voice box, it eventually led to the resolution of her vocal cord cyst.
When you get diagnosed with this, and the doctor would say that the only option is surgery, of course, it's good to listen to your doctor, but it will not harm you to try PPAR's liquid extract and even the PPAR's extract powder so that you can get better.
Where will you go? My heart is open wide.
Pwede daw dun sa mga life stage na pagdadaanan ng mga tao. merong iba't ibang priorities. So we have protection.
My name is Nesta Vicencio, and I trust Simply Nature.
I'm Sheila, your host for tonight. You are watching another episode of Simply Nature webinar, your long-time running healthcare awareness webinar here in social media. This program is co-hosted by Simply Nature International and SMG, or Simply Healed Medical Group. Tonight's topic is entitled Painless Rheumatoid Arthritis, 5 Steps to Control the Pain. We will delve into the complex roles of rheumatoid arthritis, or RA, a chronic autoimmune disease that affects millions of individuals worldwide. This webinar aims to provide you with a comprehensive introduction to the disease, including its causes, symptoms, diagnosis, and treatment options. We truly appreciate each and every one of you for watching and registering to this webinar, and for sharing this online event to your friends and loved ones who suffer from RA. We would love to know where you are watching us from tonight, so please comment down your locations. Just before we introduce the next speaker, or our speaker for tonight, please know that we will be having a what we call AMA, or Ask Me Anything portion. So yes, questions are very much welcome. Just drop them down on the comment section. To start off our discussion tonight, for tonight's topic, with the help of his patient case presentation, here is our speaker, a graduate from St. Luke's Medical Center, College of Medicine in 2016, and he is also a diplomate of Medical Society's International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine, the president of SMG, or Simply Healed Medical Group, Dr. Jansen Kalalan. Please watch this.
Hi everyone, this is Dr. Jansen Kalalan, your lifestyle medicine doctor and the president of Simply Healed Medical Group, helping you in your recovery from cancer. For this webinar, we're going to talk all about rheumatoid arthritis and not about cancer just yet, no? So rheumatoid arthritis is actually one of the debilitating diseases that we have now presently, and it is considered as one of the chronic diseases that causes a lot of problems with in terms of quality of life. Today, I'm going to present you a case of a 43-year-old female on how we were able to manage the pain that she was feeling. Now, this patient of mine have had rheumatoid arthritis for 10 years already. When she consulted with me, she was complaining of multiple joint pains, no? Specifically on her knees, jaw, nape, and fingers. Now, she stopped taking her medications because she finds that it was not helping her. Now, we will find out whether it is true that whether or not her medications are not actually helping her, or she was actually quite frustrated just with frustrations. Now, before we proceed with the case, first let's define what rheumatoid arthritis is and compare it with other arthritis that we know. So rheumatoid arthritis is actually an autoimmune disease. So by autoimmune, this means that the immune system attacks our own body or attacks the host. So for rheumatoid arthritis, it is when the immune system attacks our joints, which causes the pain. Now, in contrast with osteoarthritis, osteoarthritis typically is an arthritis that occurs because of wear and tear, and also because of arterial blockages that happens, no? To begin with, what are the joints that is usually affected with rheumatoid arthritis? Okay, so firstly, rheumatoid arthritis mainly affects these joints, which are your metacarpophalangeal joints, which are the joints that is more proximate to your palm, and also the proximal interphalangeal joints, which is these joints. In contrast, osteoarthritis mainly affects the distal interphalangeal joints. Okay? For rheumatoid arthritis, it usually starts in small joints in your hands and feet and can spread to your wrist, to your elbows, shoulders, neck, ankles, knees, and hips. Usually, the pain is symmetrical for rheumatoid arthritis compared to osteoarthritis, which is usually on one side of the body. For the frequency of pain, rheumatoid arthritis usually presents as morning pain and stiffness for more than 30 minutes. And usually, the main telltale sign of rheumatoid arthritis is when we use our hands. The more we use them, typically this is when the pain usually subsides. This is in contrast with osteoarthritis, where for osteoarthritis, the stiffness usually is less than 30 minutes and usually is in the morning as well. And lastly, osteoarthritis typically occurs during the later stages in life or for senior citizens. On the other hand, for rheumatoid arthritis can actually occur even when you are younger. Now, speaking of which, who are more affected for rheumatoid arthritis? It is actually women, no? Women are 3 times more likely to develop rheumatoid arthritis compared to men. And 80% of rheumatoid arthritis patients are between the ages of 35 and 50, which represents a younger age group compared to those with osteoarthritis, which represents more of the elderly population. Now, what are the risk factors for developing rheumatoid arthritis? Number 1 would be age. Number 2 would be your genes. Another one would be lifestyle, mainly because of the intake of different meat products. Also, rheumatoid arthritis patients typically also have an increased risk of developing heart attack and stroke compared to osteoarthritis patients, where we cannot see such risks. And lastly, how do we manage patients with rheumatoid arthritis? So mainly, we have 3 main approaches. Number 1 would be lifestyle modification. Number 2, medication. Number 3 is supplementation. So for lifestyle modification, we can ask rheumatoid arthritis patients to exercise more to lessen the pain and also to increase the strength of their joints. Another one would be to change their dietary approaches. Okay? So for rheumatoid arthritis, typically we find that a whole food plant-based diet is more healthy, or it also reduces the pain, it reduces inflammation for patients with rheumatoid arthritis. And in contrast, a diet high in meat products, high in fat, oil, and sugar typically contributes more to the inflammation and pain that rheumatoid arthritis patients feel. And lastly, definitely we would need medications like pain relievers, disease-modifying drugs like your methotrexate, hydroxyurea, hydroxychloroquine, etc. However, for rheumatoid arthritis, methotrexate therapy is still the mainstay or the first line, which I will show you for the patient. Now, let's go back to the patient. So this patient, again, is not taking any medications. She only takes supplements. And here are the supplements that she is taking. So number 1 would be Milka. Milka is a milk or a meal replacement supplement. Fern D. Fern D is a vitamin D. Fern E is vitamin E. Fern AC is A and C. She also takes curcumin. Curcumin is actually very helpful. However, the problem here is curcumin is not bioavailable. Okay? Although curcumin is very helpful for managing pain. So, the main addition here would be, or the main modification here should be, the patient's curcumin have to be taken with ground pepper, because ground pepper can increase the bioavailability of curcumin so that the patient can actually get the benefits of curcumin. Next would be spirulina, sambong. Sambong is an herbal supplement used as a diuretic. She also takes guyabano, mangosteen, and moringa. For her diet, the patient is not following any specific diet. So she mainly eats whole grains, fried chicken, fried foods, mainly foods prepared in oil. Although she drinks coffee with a little bit of sugar, which is fine. She also eats eggs, And for her physical activity, because of the pain that she is feeling, she remains sedentary, and her sleep is satisfactory. Although, in terms of sleep, she has difficulty initiating sleep because of the pain. Upon physical exam, we can see a lot of Bouchard nodes on her fingers and both hands. Now, Bouchard's nodes are nodes that are present on her proximal interphalangeal joint. So, in these joints on her fingers, which is actually consistent with the pattern of for rheumatoid arthritis. Now, these are her laboratory tests that she gave me. This is actually her 2020 laboratory tests. This is her blood chemistry test, which came out very well. It is normal. However, her ESR, which is the erythrocyte sedimentation rate, is elevated, no? Back 2020. Now, the erythrocyte sedimentation rate is the main laboratory tests that doctors use to gauge the inflammation inside the body. However, please remember that ESR is very non-specific. There are many causes or many factors that can cause an elevation in erythrocyte sedimentation rate. Now, this is not specific to rheumatoid arthritis or any arthritis per se. So, even if we see an elevation ESR, it doesn't necessarily mean that the arthritis or the rheumatoid arthritis worsened. We still use pain or the pain scale or the clinical picture of the patient to gauge whether or not the patient actually improved or not. Now, this is the laboratory test as of March 2023, which is the laboratory test that she presented to me upon consultation. For her complete blood count, it is unremarkable. Her ESR at this point in time increased to 124 already. So why? This might be because she stopped taking her medication altogether. That's why we see an increase in ESR. Also, she was complaining actually of worse pain now compared to 2020. Furthermore, her blood chemistry test actually showed pretty unremarkable result. Next would be her CRP. Her CRP is actually elevated, no? And what does CRP stands for? CRP is C-reactive protein. It is also a marker of inflammation, which is more sensitive and more specific. For these kinds of patients, it is important for us to request both ESR and CRP to give us more confidence about the inflammatory levels of the patient. Now, with this information, what did I advise her to do? So this was my plan for her. So first one was that I advised her to go on a whole food plant-based diet. So mainly, a diet centered around unrefined and unprocessed fruits, vegetables, whole grains, and legumes. Legumes will be your beans, nuts, and seeds. Now, why did I prescribe or why did I tell her to eat beans, nuts, and seeds? Okay, because the beans, nuts, and seeds have strong anti-inflammatory properties as well. These are not the triggers of arthritis. Okay, remember, this is rheumatoid arthritis, which is an arthritis that is caused by the immune system, not gout. Okay, gout is very different, which is caused by increased uric acid or uric acid crystals found between the joints. Although legumes, no, beans, nuts, and seeds have relatively higher uric acid compared to the other plant foods, this will not cause an increase in the pain to the patient, okay, because we have different disease entities. And for that matter, speaking of gout's main reason why people suffer from arthritis, arthritic gout, is because of animal food products, sugar, and high uric acid foods. Not really because of legumes or beans, nuts, and seeds. Now, let's go back to the plan for the patient. So, so this was my plan for her. So, firstly, I prescribed her with PPAR soft gel. So, why PPAR soft gel? Because PPARs is an immunomodulator. So, PPARs can help reduce her inflammation and also increase her immune system whenever she is exposed to certain viruses, etc., so that her body can still fight these infection. Next would be Folicard B+. Folicard is actually a vitamin B complex. This is needed for all patients who are following a whole food plant-based diet. And for her medications, I prescribe methotrexate. Methotrexate at 5 tablets once a week, which is at 12.5 milligrams per week of dosing. Next one would be melatonin to help her sleep, and to manage pain, celecoxib. And to check for improvement in her laboratory test, I requested the following laboratory test results to be taken or to be done after a month. Now, the following month, on April 13, the patient actually messaged us again and with some feedback. So, right now, on April 15, the patient told us that she is already trying to improve her diet. She is eating less refined grains, no, like white rice. However, she still cannot move her shoulders. This shoulder problem of her had been present for quite some time now, which did not improve. Also, since the time that she took PPARs, she only just took meloxicam once. Now, meloxicam is a pain reliever. Other than that, she was not feeling any pain already, and she can move her other joints already. The following day, the patient actually told us that she's more comfortable when she's taking meloxicam. However, even without meloxicam, she feels that there are improvement. Although sometimes she still feels joint stiffness. So at this point in time, do we expect some improvements present already with her conditions with what we prescribed? Actually, not yet, because it has been around 2 weeks since I first saw her at this point in time, no? So, now at this time, do we expect these kinds of improvements already with the patient? Actually, not yet, no? Since the patient just started very recently with the medications that I have prescribed, and I was actually quite surprised that she already feels improvement in terms of pain since she started taking PPARs. Now, with these feedbacks, I actually told her to follow up with me to go for a consult. Now, upon consultation, she reported that her pain already improved. Now, it is around 7 out of 10. No? Before, it was 9, 10. No? The joint stiffness is actually very, very uncomfortable. Her sleep also significantly improved because of the improvement in pain. She does not feel fatigued already upon waking up because of the improvement in sleep. Now, her complaint is still her shoulders, which now alternates between left and the right. At this point in time, my plan is to ask her to still continue her medications and to continue celecoxib. Now, it is apparent that the patient is taking meloxicam instead of celecoxib, which is fine. However, my problem with meloxicam is that the patient cannot be on this medication for a very long period of time because meloxicam can increase the patient's risk of developing gastric ulcers or stomach ulcers for that matter. Okay, that's why I asked her to shift to celecoxib instead, okay, which is more mild for the stomach. The following month, on May 2023, the patient again underwent laboratory test results, no? And this is the results of her ESR and CRP. Her ESR actually increased from 124 to 135, and CRP remains to be elevated. Now, upon further investigation, the patient actually messaged us that she was actually taking PPAR's powder instead of the soft gel that I initially prescribed. At this point, the patient did not follow up anymore, so we were not able to get more details already. So, at this point, what would be the explanation why the ESR increase in levels? So, there are a number of possible explanations. Number one, PPAR's powder might be too strong for her. Okay, so remember, PPAR's is an immunomodulator. If it is an immunomodulator, and this is PPAR's powder, okay, the powder level is might have a very high concentration already of PPAR agonist, which stimulated her immune system, which can be the reason why the ESR increased. It's because the white blood cell count is already, or the white blood cells are already, or the immune system already is being stimulated too much. Okay, another explanation would be she, at that moment, she actually her body is actually fighting an infection. Although she did not report any symptoms, but this can happen sometimes. No, our body can fight off infection even though we are not feeling any symptoms. So, had the patient followed up with me, what would be my next course of action would be? So number one would be to change her pain medication to a stronger one. So it would be either etoricoxib or naproxen. Also, I would advise her to increase the methotrexate dose from 12.5 milligrams per week to 15 milligrams per week already. I would also advise her to stop PPAR's powder and just continue on the tablet so that she can also get the antioxidants and the phytonutrients present in the tablets. Can we start PPAR soft gel? It would really depend on her clinical picture at this point. No, however, again, the patient did not follow up already, so we were not able to make further recommendations. Also, I would add vitamin D supplementation. Why? Because vitamin D has been found to prevent the occurrence and the development of rheumatoid arthritis by inhibiting inflammatory markers, no, or inflammatory factors. So vitamin D mainly acts also as an immunomodulator for rheumatoid arthritis patients. Okay? And for vitamin D supplementation for rheumatoid arthritis patients, what would be the ideal dose and how long should patients take this? This is now the result of the study. For vitamin D, given for more than 12 weeks at a dose of 50,000 international units per week, the pain scale improved, the disease activity score improved, the number of joints that are painful also decreased. With this information, I would have asked the patient to take vitamin D supplements at 10,000 international units once a day. Now, this ends our case presentation. We're now open to answer whatever questions you may have.
There you go. Thank you so much, Doc Jansen, for that very informative and encouraging discussion. Now, we are now in the Q&A portion, or what we call the AMA, or Ask Me Anything portion. So, welcome po ang ating mga questions. Just please comment them down on the comment section. Okay? So, without further ado, to answer all our questions for tonight, I'd like to call on, once again, the president of SMG, or Simply Health Medical Group, Dr. Jansen Calalan. Doc, good evening.
Hello, Sheila. Hello, everybody. Good evening. No, thank you for watching. So I hope you ate well this evening, because we're going to be talking all about food, because there are a lot of questions that's related to food.
That's true. That's true, Doc. Doc, I just want you to know, this episode, or this webinar is already our 118th episode. Okay. So thank you so much, everyone. I just want to greet, of course, our lovely Miss Lily Neo of Malaysia, and of course our avid viewer as well, Miss Amelia Rivera. Thank you for continuously watching us. Okay, Doc, we have a lot of questions, wonderful ones. So let's start.
Okay, let's start.
Okay, coming from Miss Jeannie from San Mateo, I am already trying to avoid foods that could trigger the pain. However, I really don't know why it keeps on acting up without any reason at all.
Yeah. For this, no, we have to know why you are in pain in the first place. So diagnosing your arthritis is very important. Okay, because if we do not know what kind of arthritis you have, then we won't know why is it, what is the trigger, why is it acting up. So with the diagnosis, we'd also know what kind of management would be better for you. Okay, so for me, better for you to go to your doctor, go for a consult, no, so that a proper diagnosis would be done. Okay, but as of this point, no, if you still have pain, then pain relievers would do you good. Okay, just have to select the proper ones. But on the get-go, probably paracetamol first, no, on the get-go right now. If you're not taking any medication, paracetamol would be better. Okay, don't take the other ones first. No, just take paracetamol, then go and see your doctor. Okay.
Thank you, Doc. I'm sure a lot of our viewers are not only the patients experiencing the RA or rheumatoid arthritis, but also the caregivers. I'm guessing, caregivers of our lolos, lolas, or even our parents out there who are also experiencing this illness. So there you go. Thank you, Doc. Okay, next question coming from Ms. Jacob of Calamba, Laguna. Will PPARs have interaction with my meds? Taking vitamin B complex twice a day, Lagaflex once a day, and Fixcom for tuberculosis.
No naman. No, it won't interact with your medications. So if you are taking PPARs or about to take PPARs, very important that you take PPARs on an empty stomach. Okay? Now, I don't know the proper protocol for you because I haven't seen you. But, well, according to Simply Nature, their product label, no, the ones that on Simply Nature's Facebook page, okay, is that the products have to be taken on an empty stomach. So take it upon waking up. Then after eating, after a while, then you can begin taking the rest of your medications. Okay? But to get go with inside the body, they don't have any interactions. Okay.
Thank you, Doc. Thanks for also raising up that our PPARs don't have any contraindication with any other medication. Thank you, Doc. Okay. Let's go to another question coming from Mr. JM from Pasig. How can management of RA relate to ankylosing spondylitis?
Okay. For everybody's information, ankylosing spondylitis is also a type of arthritis. So it's an inflammation of the joints. Okay. However, the location is different because for ankylosing spondylitis, the location is on the spine. Okay. So bones that are located on the axis of the human body. So that would be your neck, your spine, no, up to the tailbone. Okay, so that would be where ankylosing spondylitis would occur. In contrast, for RA obviously manifests on your peripheral joints, no, the joints on your hand, your elbow, your feet, no, your toes, your knees, sometimes your hips. Hips can also actually can be affected by RA as well. No, although seldom, it would be less, no. However, the mainstay of the management is to control the pain. So it's the same, no? Pain relievers, okay? However, the main difference here is that for RA, you use DMARDs, okay? So disease-modifying medications, no? And biologics. For ankylosing spondylitis, it's different. Usually, ankylosing spondylitis, of course, anti-inflammatory medication, steroids sometimes as well. Okay, so that would be the main difference in terms of medication. However, for the lifestyle, the food that you're eating is the same. Okay, so it has to be a plant-based diet. Why? Because a plant-based diet is anti-inflammatory, and of course, no, avoid the foods that causes inflammation, which are mainly animal food products, ultra-processed foods, sweetened beverages, these foods. Okay, so that would be on the get-go. That would be how you can approach it. Okay.
Thank you, Doc. I'm sure now a lot of our viewers, avid viewers, can relate. You have always been mentioning in our webinars about the plant-based diet, and it's not only applicable for cancer patients, not only applicable for cholesterol, high blood cholesterol patients, but also here in RA as well. So
you're dealing with inflammation, no? So yeah, basically that's how you can approach things. Okay, that's actually where the management of RA and ankylosing spondylitis intersects.
Thank you, Doc. Okay, another question coming from Atita, coming from Las Piñas, who has an osteoarthritis. Doc, do you recommend knee replacement in my case? Age range, she's around 60 plus.
Yes, it's okay. Well, I don't know the other details. No, I only know your age. But at your age, yes, you can undergo total knee replacement. Why can I say so? Because my grandma, 81 years old, just underwent total knee replacement surgery just a few months back, actually.
Okay. I'm very curious about this. How does it not? How do they do it? What do you mean when you say knee replacement? Is it being replaced by a metal or
Yes,
something?
exactly. So remember, your knees, no, locks up like this. Okay.
Yes.
So the doctors will replace this, okay, this one and this one. So that would be metals already. Titanium. It would be replaced by titanium. Okay, so that when you walk, it won't cause any frictions anymore and cause unnecessary pain. Okay, the procedure is actually very fast. 30 to 40 minutes, you're done. The recovery is actually quite fast as well. My grandma was admitted just for 3 days. 3 days, starting from when she was admitted. The following day, she was operated on. The following day, she already began physical therapy. The next day, 4 days, no. The next day, she went home already.
That's very encouraging.
that was,
And this is highly encouraged if the patient is in too much pain or perhaps cannot walk at all.
Yes. Especially if there are already deformities sa knees, you cannot walk already, then that would be indications for total knee replacement already. Especially when you are in excruciating pain always.
Thank you, Doc, for that information. Okay, let's go to the next question coming from Ms. Lorna from Quezon City. By the way, Doc, actually these questions, Doc, were thrown to us ahead of time before this webinar.
Wow.
Okay, yes, and I'm also very pleased that I am seeing a lot of our viewers, even though despite of the topic, which is quite rare that we do here in Simply Nature. So yeah. Okay, the question is with DM2, CVD, right pons, and hypertensive, with what I feel now, numbness in my right hand, pains on my joints and shoulder, is it arthritis? And what could it be, or what kind of could it be?
Yeah. For this, no, obviously, it's arthritis is basically inflammation of the joints, no? So yes, you have arthritis, no? However, what kind, we have to know specifically what kind. So there are a lot different kinds of arthritis. Okay, I have to know which specific joints. We have to do some blood tests as well to confirm. However, the more common ones with your comorbid issues, okay, with your comorbid illnesses, I will think that this might be gouty arthritis. Okay, why? Because of DM type 2. Because if your blood sugar is high, that typically makes you more prone to gout as well. Okay, so that's all.
I highly suggest you to go because you've mentioned so much, a very detailed condition. Okay, I do suggest you to go for a consult with Doc Jansen. And for others of you who wish to have a consult with Doc Jansen, the link where you can schedule a consult is on the description box and on the comment section as well. Or you can just simply type in how to consult. Miss Beth from SMG will definitely get in touch with you. Okay? Thank you, Doc. Okay, another question coming from Miss Weng of Malolos, Bulacan. Doc, need ba ng maintenance meds for RA?
Unfortunately, yes. Because rheumatoid arthritis, it won't go away anymore. It's not reversible. It's a chronic disease. Once you get it, once na magmanifest siya, that would already be with you for the rest of your life. So chances are you'd be on medications for the rest of your life as well. The main difference will be the number of medications and the dose. Because those things we can minimize. We can minimize depending on your lifestyle. Okay, especially the food you eat. So to answer your question, yes, you need already maintenance medication for RA. Okay, you need it to manage the pain and also to prevent the deformities.
This is on top pa po, Doc, no, of the other medications for the other comorbidities.
Yes. If there are other comorbid conditions, other diseases, other pre-existing illnesses that is present, like for example, hypertension, diabetes, you have to take those the medications for those as well. However, hypertension kasi and diabetes can be reversed. RA is not. RA kasi is an autoimmune disease, so it's your immune system acting up on your own body. So that's why you cannot reverse it. Okay? So with hypertension kasi and diabetes, those two are lifestyle-related diseases. So if it's lifestyle-related, then the solution for those two would also be lifestyle. That's why they can be reversed with just lifestyle treatment only. No. However, for RA, if you do well yung sa lifestyle, we can only minimize the dose of the medication. We can minimize the number of medications you're taking. We can minimize the pain, and we can prevent your condition from progressing too fast or worsening too fast.
Still very helpful, right? It's like
Still very helpful. Yeah, still very helpful. Kasi you'll be able to maintain your quality of life for a longer period of time.
Yes, and having plant-based diet, it's like hitting 2 or 3 birds in one stone, right?
Yes.
Okay, thank you, Doc. Okay, another question coming from Miss Frelin Grace. She has a gout, Doc, and she's coming from Puerto Princesa.
Oh.
How to remove pain not drinking meds? Is it
A
possible, Doc?
Lifestyle na yan, lifestyle. And also, physical therapy. Yeah, those are the main. Also, another one, depending on where the pain is, you can actually undergo ozone therapy. Yeah, it's something that I am studying now, and it's really a very promising modality. Yeah, ozone therapy. Some of the people here who have heard it first, no, yung ozone. If you Google kasi, ozone, di ba, it's known to be something toxic na pagka na-inhale, it can irritate the lungs. Yes, that's true, no? Ozone, that's what ozone is. However, at a very low dose, not too low naman, no? Not to elicit an effect. However, at a dose na much lower, can actually stimulate the body to heal itself. So, it can be very effective for pain management as well, yung ozone therapy. For joints, you can actually do prolozone therapy or prolotherapy. Okay, so it's basically injecting ozone sa joints. And I've seen a lot of studies, randomized controlled trials, many talaga. Not just yung mga studies sa literature, mga trials na clinical trials na to. I've also seen some patients on how they responded. It's really good. So it might be something that you can consider. However, yeah, how to remove pain, not drinking meds, mainly lifestyle. So plant-based diet, yeah, number one. With just a plant-based diet alone, you can already minimize the pain that you're feeling.
Thank you, Doc. I'm very excited for that. That's a very interesting modality, that ozone therapy. Thank you, Doc.
Okay.
Okay, question coming from Miss Jennifer. By the way, Miss Jennifer is a clinical nurse manager, and
Oh,
her
wow.
question, yes, thank you for registering, Ma'am Jennifer. But her question is, if there is swelling in the knee, is it necessary to remove the fluid?
Yes, ma'am. Kasi if there is fluid in the knees, that will cause pressure kasi. And it is a sign that of course there's an ongoing inflammation talaga. And the inflammation is severe already. That's why you have fluid already, no? The fluid has to be removed. Okay? Because it will compress against the nerves, it will compress against the blood vessels, which can cause complications. So that's why you have to drain it. And also to prevent infection as well. Okay? Because may fluid doon, stagnant yon. So that has to be removed. Okay? But mainly to reduce the pressure on the knees. So yes, no? If there is swelling of the knee and there is fluid inside, then better to drain. Okay?
Okay, thank you, Doc. Okay, another interesting question. We have a question coming from Ms. Justin, a physician from Quezon City. Okay, RA commonly leads to deformities in the latter stages of the disease. While we may be able to achieve pain-free RA, can we actually prevent the deformities from developing? Thank you, Doc.
Hi, Doc. Doc Justin, thank you for watching. No? Yes, Doc, we can actually prevent the deformities from happening. That would be mainly through your DMARDs and yung biologicals. Okay? However, the problem here is once the deformities happen already, then the deformity is not reversible already because the bone erosion has happened already. So yeah, we cannot reverse it. We cannot reverse it or restore it back to the normal structure. No, however, to prevent the deformities, definitely yes. So that's why patients who have rheumatoid arthritis, no proven rheumatoid arthritis, you have to take your medication, or else, but the deform talaga yan, okay? So there will come a time that your fingers would have, it would enlarge, no? So parang may bato dito na malaki. No, you'll have parang payable. Okay? So yes, definitely, no. And also very important to still manage the inflammation. Okay? Kasi the inflammation would mainly be the one that will cause the damage. Okay, and the erosion of the bone. So very important to manage the inflammation. Okay? So plant-based diet pa din yan. And medications. Okay?
You know, I know that Sir Sean misses us so much because he's traveling once again abroad, no? And I'm sure if he's here, because we've been mentioning a lot about swelling or inflammation. As you know, and as some of our viewers know, no, our PPARs is a well-known anti-inflammatory. So can PPARs definitely help with RA?
Yes, definitely. PPARs kasi it's a superfood. It has a lot of antioxidants and it is very packed with anti-inflammatory nutrients. Also, aside from the nutrients per se, the PPAR agonist stimulates the genes. No, it's a gene activator. So when the genes are stimulated, the pathway for anti-inflammation will be stimulated. Okay, so that's how it works. For the medical professionals here, I'm trying to explain this in the layman's term. So medyo there's some difficulty. However, for the medical professionals here, PPAR agonists mainly inhibits N NF-kappa beta, NF-kappa beta, and then it enhances NRF2. Okay, yung NRF2, that is the main anong tawag doon? Transcription factor. Okay, nuclear transcription factor that stimulates the antioxidant system of the body. Di ba yung katawan natin, we produce our own glutathione,
Yes,
we
yes,
produce
yes.
our own antioxidants to combat
Collagen, yeah.
oxidant cells. Yung NRF2, that is the one that stimulates these systems to manifest. So that's how PPAR agonists work. Yeah.
I see. Thank you, Doc. So
It's a very powerful antioxidant actually. So
in other words, parang nahahype siya, Doc, no? Nahahype
Yes,
yung
oo.
stimulation.
yes, kasi ano din one thing as well, kasi syempre, rheumatoid arthritis is an autoimmune disease. And then syempre, doon sa, when you go to Simply Nature's website, no? So may nakasulat doon, it boosts the immune system. Okay? So it won't cause a detrimental effect or it won't worsen RA. Kasi nga, although it stimulates the immune system, it enhances the antioxidant system of the body. Okay? So, although yes, your immune system is activated, pero kasi yung anti-inflammatory or your antioxidant system is activated, so it will overpower the inflammation that is being manifested. Okay? So it won't worsen actually. It won't worsen rheumatoid arthritis. Actually, it can even lessen the pain.
I see. Very, very encouraging, right? And you are correct, Doc. We actually have a lot of medical practitioners joining us in our webinar. So thank you so much. Okay, so Doc, another question coming from Miss Belinda of Muntinlupa, a teacher from Muntinlupa. Hello po. Best exercise, Doc, what is the best exercise and best food found in PH for RA?
Best exercise. Well, depends on what you can do. However, for RA, the best exercise would still be resistance exercises or weight-bearing exercise, no? Pag sinabi kasi weight-bearing, you will think that you need to lift weights. No, you don't need to lift weights. You just have to do resistance exercises. So, one example would be to use resistance bands. Okay, so why? Because resistance exercises will strengthen your muscles. If your muscles are strong, then the more stable the joint will be. And if your joint is very stable, there will be less pain because there will be less pressure on the bones. Okay, so that's why you need resistance exercise. Okay, for foods that is good for RA would be turmeric. Turmeric kasi has anti-inflammatory or more for pain. Okay? Turmeric. However, the problem there is don't just eat turmeric or take turmeric or curcumin supplements alone. Okay? Kasi it is not bioavailable. It's not readily absorbable sa intestine. Okay? So you need ground pepper together with turmeric so that you can absorb yung curcumin or yung anti-inflammatory nutrient niya. Okay, so you have to combine both, no? So for those of you who are drinking turmeric tea, okay, adding black pepper or ground pepper would taste weird. Okay, so if I were you, I'll just get probably turmeric powder, halo sa ulam, add in ground pepper, then that's it. That would be more delicious. Or cook curry dishes. Okay, so that would be one. Another one would be sesame seeds. Actually, sesame seeds, yeah. However, you need a lot of sesame seeds. Okay, pero for me, I won't rely too much on those foods. Still better to take your medications because those foods might not be enough. No, it's always best to combine these things. No, what else? Berries are good. Well, not specifically for RA, no. However, cherries is good for gout. Okay, so if syempre parehas naman sila arthritis, there's inflammation in the joint. So cherries might work for RA as well. However, This is just something that I am thinking of that might work, no? However, it's food, so nothing wrong, diba? You won't lose anything naman if you try it. So yeah, and cherries are wonderful. Okay, ano to these are cherries that is fresh okay, not the cherries from the fruit cocktail. Okay, those are some foods, no? Blueberries there, however, blueberries is uncommon already. Okay.
Thank you, Doc. Okay, another question coming from Miss Delia, a nurse from Quezon City. Doc, is it possible onset of rheumatoid arthritis while the patient is on dialysis?
Very good question. If you are on dialysis, definitely you have CKD. Can you develop RA? You can. However, the dialysis won't necessarily cause the RA, okay, or the CKD won't necessarily cause the RA. However, those who have rheumatoid arthritis are more prone to develop CKD, diabetes, hypertension. Okay, they are also more prone to, once they have developed CKD, they are also more prone to undergo dialysis compared to the to ones that has no RA. Okay.
Okay, thank you, Doc. Okay, we have still a lot of questions. Thank you for your questions, by the way. So next question,
Sure.
coming from Miss Mary D of Makati. Are there different medications from rheumatic arthritis and psoriatic arthritis?
Yes, there are different medications. However, there would be common ones, especially DMARDs, because DMARDs are also used for psoriasis. Remember, rheumatoid arthritis and psoriasis is both an autoimmune disease. It's just that they target different organs. For rheumatoid arthritis, it targets joints. For psoriasis, it targets the skin. Okay. However, psoriasis on a more severe stage, no, on a later or a more advanced stage, you can develop psoriatic arthritis as well. Okay, so there will be similarities. However, difference meron din, definitely, especially when it comes to the biologics. No, however, there will be a lot of intersections with these two conditions in terms of medication. Okay.
Thank you, Doc. Okay. Okay. Another interesting question coming from a dentist from San Jose del Monte, Bulacan, Ms. Dr. Jovita. What exercise needed for knee and hip pain?
Resistance exercises pa rin. Yeah. So, for me, it would be better for the patient to use resistance bands. Okay, kasi, especially for knee and hip, no, I would surmise that this patient would have difficulty ambulating. So, any exercise that is standing up would be very difficult for the patient. So, better sitting down. Resistance bands would do good. So, I'll give you an example, no? You can tie your resistance band to one leg of the chair and to the leg. Then the patient can kick. Okay, so I hope you can imagine. So that's one, no? One way on how the patient can strengthen the knee. Okay. There are others pa. There are other exercises. For the hips naman, you can actually do some while sitting down, while lying down. So you can actually put a you tie the resistance band to the leg. Okay. Then tie it on probably the leg of the bed, no? Tapos ganun din, you kick. Yan. Para ma-strengthen yung hips and yung okay, so those are just some ways. So there are a lot of videos in YouTube that you can simulate. However, resistance exercise, that would be more recommended.
Great tip. Thank you, Doc. Those are great tips for our patients here. Okay. Okay. Another question coming from Ms. I think this is just a reiteration of what you said a while ago, because the question is how to treat the swelling of the finger joints.
Ano pa din? Yeah. So inflammation is key here. So you have to reduce inflammation. So how? Food that you're eating. Food that you're eating. Number 2, medications. Yeah, basically that's it. Okay. Yeah.
Okay. Next question, Doc, what is the difference between osteoarthritis and gout? Coming from a midwife.
Very good question. Very good question. For osteoarthritis, typically there are two, no? For osteoarthritis, number 1 is weight bearing kasi. Okay, so that's why nagigiskisa na yung joints, okay? There's a lot of friction already. That's why it's inflamed. Another one is osteoarthritis because of a blockage that is supplying the joint. So atherosclerosis, arterial plaques can actually cause osteoarthritis as well. Okay? So you have to be careful. So it's actually linked to heart disease, high blood cholesterol, diabetes. Okay? For gout, the difference here is osteoarthritis is a pain that occurs, for example, upon movement or upon movement, no? So that's one. Another one, yung gout is different. Gout happens when you eat something. There's a trigger. Okay? It's osteoarthritis doesn't occur that way. Okay? For gout, it does. And the distribution of the distribution of the joints, no? Yung joint pains, yung joint swellings is different. For gout, it's usually the big toe, your hands, your wrists sometimes, your elbows, no? So if you will notice, the joints that are affected in gout is more on the peripheral joints or the distal joints that are away from the body. Okay? Different from osteoarthritis. Osteoarthritis involves the larger joints or joints that supports your weight. So these would be your hip joints, your knee joints, your spine can actually also develop osteoarthritis. Okay? These cases. Okay? For gout, different. For gout, that would be your ankle. Although the ankle is also weight bearing, no, pero it can also happen kasi it's more distal. The one that would be greatly affected, more commonly affected, is the toes, especially the big toe. Okay, so it will also affect the elbow and the wrist. Okay, so that's the main difference. However, food triggers would definitely be a hallmark of gout. Gout can also affect the knees.
All along, akala ko, Doc, no, I thought it's just the toes that's being affected by gout. Now I know it's, all the other joints very distant to the body.
They have intersections itong osteoarthritis tsaka yung gout. Kasi, for example, knees. Knees is a joint that is actually common between osteoarthritis and gout. Okay? So, however, yung distribution ng gout kasi, it would be more for the distal joints.
Look, parang it seems no that you're staying in shape, no, is very important to avoid these types of illnesses. Okay, thank you, Doc. Another question coming from Ms. Nurse Melissa. Aside from ANA test, what are the recommended blood tests for RA?
You have a lot, no? So let's start with the more common ones. Of course, your complete blood count. Okay, so you would be interested to look at the white blood cell count. Okay, what else? Your complete blood count can also include your ESR or your erythrocyte sedimentation rate. That is a marker for inflammation. Then another one would be your CRP. So for me personally, I prefer high HSCRP, yung highly sensitive na CRP. CRP stands for C-reactive protein. That's also a marker for inflammation. Okay, so that's also one of the blood tests that rheumatologists use. Another one would be anti-CCP and RF. RF is rheumatoid factor. Okay, and to definitely diagnose RA, you need a hand X-ray to take a look at the bone erosions. So kapag may bone erosions, then you have these blood tests, elevated, then more or less the diagnosis for RA would be made already. Okay.
Very informative. Thank you, Doc. Those are interesting. Some of the tests that you've mentioned, this is the first time that I've heard of them. Even this X-ray for the palm is the first time I've heard of it. Thank you. Okay, another question coming from Mr. Nito of San Juan. Is knee replacement only the solution for type 4 osteoarthritis?
Depends, no? However, on the get-go, depends on how bad your knee is. But now it's not the only solution. Okay. However, the definitive treatment for this would definitely be knee replacement. Okay. Another option would be prolozone therapy. Because prolozone therapy can stimulate the healing of the joints of the joints. So once it heals, the pain would be less, less inflammation as well. In fact, when they compared it to steroid injections, those who underwent prolozone therapy or prolotherapy has they have better pain control within the next 6 months. So it's it's really good. Yeah, it's really good.
Interesting and promising siya, Doc.
Yeah, very promising siya actually. Yeah, because it stimulates the healing. Yeah. However, again, prolotherapy or your prolozone therapy I don't know if it would actually help you because I don't know the stats only. But definitely, it's not the only solution for type 4 osteoarthritis, no? Especially type knee. Okay. However, the definitive solution for this is definitely total knee replacement. Okay.
Ako, I still do suggest you, Mr. Nito, to go for a consult with Dr. Jansen. At least, Dr. Jansen can actually give recommendations for the next actions to take, and at the same time for the laboratory test. No, Dr. Jansen can actually give the requests.
Yeah, we can actually do it sa ALTA, Integrative Medicine Center at Perpetual Health Las Piñas. I'm also holding clinic there. So if you're interested, just call them up. Then set an appointment with me. So I can
Yeah, or you can easily just type in how to consult. Miss Beth from SMG will definitely get in touch with you right away. Okay. All right, another question coming from Miss Priscilla from Antipolo. What causes or ano ang sanhi? Bakit may paninigas ang darili sa kamay o ng kamay? What would be the cause of the stiffness in the fingers?
a lot of reasons. Okay. So yeah, I would have to see you to know for sure, no? Kasi this can be arthritis, it can be something else, no? Pwedeng carpal tunnel syndrome, no? Depende. I have to assess you to know for sure. Okay? But
mamaya pianist pala siya.
yeah, but definitely no inflammation is involved. So plant-based diet. That's something that you can do immediately. Okay?
Exactly. Thank you, Doc. Okay, another question coming from Ms. Shamita. Wow, from Malaysia. Thank you for registering. As a nurse, how to maintain quality lifestyle?
Oh, okay. As a nurse, I don't think it would be that difficult, no? Kasi nurses naman are very well versed when it comes to health. So, however, here's something that you can try to achieve, no, in your life, no, because healthcare professionals, kasi, nurses especially, I don't know where you're working or what kind of healthcare setting you're working at. So it might be a hospital based, might be outpatient. However, if it's outpatient, it would be way easier compared to hospital based because inside the hospital you would have to go night shifts. Okay, so definitely from there your sleep will suffer. Okay. However, if you're working outpatient, it would be better. Okay. So here's something that you can aim for. Okay. So number one is nutrition. So I'm always telling all of you, my patients, whole food plant-based diet. Okay. So how do you do that? So you focus your food intake on these 4 food groups: fruits, vegetables, whole grains, beans, nuts, and seeds. Okay. Beans, nuts, and seeds. Okay. However, make sure that each food group or each food category only takes up 1/4 of your plate. Okay. So the legumes, your beans, nuts, and seeds, would only be 1/4. Okay. So focus on those 4 food groups as much as possible. Breakfast, lunch, and dinner. Those foods are the ones that you should be eating. Okay. And since this is a plant-based diet, just supplement with vitamin B12. Okay, 50 micrograms once per day is enough already. Okay, choose any vitamin B12 supplement in the market. As long as it's 50 micrograms, that's okay na. Okay, next would be physical activity. For physical activity, we have 2 general. No? Actually, there are 4, but I'll just talk about 2. One would be cardio exercise or aerobic exercise. So what you need there is 150 minutes of moderate intensity physical activity. Then, if you want a shorter one, 75 minutes, then you have to do vigorous intensity. Okay? What is moderate? What is vigorous? I won't answer na. However, some examples of moderate intensity will be brisk walking and cycling. Vigorous intensity jogging. Okay? Okay, next. Another type of physical activity is resistance exercise or strength exercises. So this one, you only have to do it 2 to 3 times a week. Then you have to work out all major muscle groups. Okay, so for each major muscle group, that would be 3 sets of 8 to 12 repetitions. Okay, so for your biceps, so 3 sets of 8 to 12 like this. Okay, yeah, so that's what you need to do. So major muscle groups would include your shoulder, your biceps, your triceps, your chest, your abdomen, your back, your hips, your legs. Okay, so that would be for physical activity. Next would be for sleep. For sleep, you need 7 to 8 hours. Okay, that's it. Okay, 7 to 8 hours. It should not be 3 hours. Then you wake up. Then 4 hours sleep again, or you sleep for 5 hours. Then you wake up. Then you sleep for 2 hours. No. Okay, the body will not consider that as 7. So you have to sleep straight 7 hours. Okay. How do you make it? What can you do to make it 7 hours or to have good quality sleep? Remove your gadgets when you're about to sleep. Okay, or use a light filter.
Yes.
Yeah. Also exercise and expose yourself to the sun. Okay, so those are some tips. Some tips.
I feel like I'm being consulted by Doc right now. And I am imagining, can I really do the 75-minute vigorous or 150 not vigorous?
Yeah, you have to make time.
You mentioned the sleep cannot be done in accumulated format. But how about the exercise? Can I actually do it in an accumulated within the day? Yes.
For example, no, I'll give you an example. So for example, you want to do 30 minutes of exercise a day. So you can do it in 10-minute bouts.
Okay. That's
Like,
good to hear.
as long as it's 10 minutes, not less, okay? Because for it to be meaningful, it should be 10, at least 10, okay?
Kaya. Can. Thank you, Doc. Okay, another question coming from Miss Malu Magsalin. Doc, will you have seminar or webinar on NMO or neuromyelitis optica? Are we having that, or it's a good suggestion?
It's actually quite rare. So we're gonna be
Not
thinking
yet.
not yet, but we're going to bring it in the pipeline. So who knows?
Yes, who knows? And I love that you are suggesting specific topics for us to discuss here. For those of you who wish to see a specific topic or some topics for us to discuss, please comment them down. Okay. All right. Coming from Ms. Ruth Tumalon. Good evening, Doc. What are the ingredients of PPARs and the meaning of PPARs?
Okay.
I'm Mr. Shyan.
Okay, I'll be speaking for Mr. Shyan Lim here. So Simply Nature PPARs is just the brand name. Okay, it's the brand name. So what does PPARs mean? It's peroxisome proliferator activating receptors agonist. Okay, so Simply Nature, that's PPARs, no? Yeah, that's what it means. Okay, I won't expound it further because that is name of a nuclear receptor inside the cells. Okay. So what's the main ingredient? Okay, the main ingredient is microalgae. Microalgae. That's it. Nothing else. It's microalgae. Okay. So they just named it PPARs because this type of microalgae that Simply Nature has contains the most amount of PPAR agonists. That's why they named it PPARs for their brand. It's a brand name. Okay,
I see.
that's how it is. That's how they made it. Okay, at least from my understanding, as their as one of their doctors. Okay.
Thank you. But it's a good thing that you have asked about what is PPARs. Thank you, Doc. Okay, another question coming from J. Rainer Martinez. Hi, Doc. You said that the plant-based diet is the best for management kasi anti-inflammatory. But how about those that causes increase in uric acid? So magka-gout attack din?
Okay. Just to clarify, no, legumes are not the ones that causes gout. Legumes, beans, nuts, and seeds. They are not the ones that
Yes.
causes gout.
The
Okay?
munggo, always a culprit.
So always the culprit, okay? So later on I'll explain why. So the foods that causes gout are meat, red meat, especially. Includes also poultry, okay? Fish, not so much, okay? Uh, Aside from those, you have your innards, yung mga laman loob, okay, in Tagalog. Innards would include your liver, your intestine, your kidney. Yeah, people eat kidney, okay? What else? Papaitan. That's also one. Also, pig's blood. That's also one. That's also very high in uric acid. What else? Yes, those are, I think that's it, no? Pig's brain, lungs, they also eat those things. I find it weird though, but people find them delicious. But just to remind you, those foods are very high in uric acid, no? Innards. So aside from those, we'll now go into your sweets. So any food that is very high in sugar can cause gout. Okay. Example would be your sodas, sweetened beverages like your iced tea, powdered juice drinks, juice concentrates can also because of the high sugar. Foods that has basically foods that has high fructose corn syrup. Yeah, so you have to look for those ingredients, no, in your grocery items. What else? What else? Yeah, I think those will be the ones. Okay, so those are the foods that causes gout. Okay, so here's the thing. Why does eating the peanut and the mongo or the mung bean causes pain? And yet, when you eat those foods that I have just mentioned, it doesn't at all. Another thing pala, alcohol, especially beer, that also causes gout. Okay? So how does this happen, no? So if you think about it, the foods that you eat 3 times a day will be your meat products, sweetened beverages, maybe alcohol for some people. Okay? So you eat them 3 times a day. And yet you don't feel any pain because let's say for example this is your pain threshold. Okay? If you go above that, you'll feel pain. So the foods that I have just mentioned that causes gout brings you to your pain threshold right about this much. Okay? The legumes, if you remove all these things and you eat legumes as only, beans, nuts, and seeds, it will only bring your pain threshold for gout up until this level. Quite low. Okay? Now, if you combine those two, you are eating those foods that I have just mentioned, causes gout, 3 times a day, so your pain threshold is right over here. Then the moment you eat the mung bean or yung munggo, you surpass the pain threshold right about this much. Okay? So you feel pain. Now, who will you blame? The mung bean.
The munggo.
Munggo, okay? So poor mung bean. So, but it is not the one that causes gout per se. Okay? It can cause the trigger because you just surpassed the pain threshold. Okay? However, here's the thing. If you remove all the foods that I have just mentioned, red meat, innards, sweetened beverages, alcohol, if you remove all of those and just eat legumes, you will not trigger your gout. You will not. And for that matter, if you have gout, avoid those like the legumes first, no? Try to lower your uric acid levels first. See if you still feel pain. If you're not feeling pain anymore, uric acid levels are normal, you're not taking medications, then you can reintroduce the legumes. You won't feel pain, I promise.
Thank you, Doc. Just to echo out what you mentioned a while ago, it's guys, the munggo is very innocent when it comes to your pain. So it's the what causes pain is because they are being eaten together with the chicharron on top, and also the coke, right? Or maybe the sodas. Okay, so that's very clear. Thank you, Doc. Okay, another question coming from Ms. Via Cordero. Doc, aside from arcoxia, what else can I take if I have kidney and liver cirrhosis? Because the pain is always present on my knees and my feet.
Very difficult. If you
Go
have
for a consult.
CKD, yeah, go for a consult. But if you have, yeah, you have to go for a consult because you cannot buy the medication without the prescription. But very difficult. You cannot take Arcoxa because you have CKD. NSAIDs are no more already because you have CKD. The only thing that is left would be you have liver cirrhosis as well. Opioids would be the
For
next
the
one.
pain. Oh, okay.
For the pain,
Go for
opioids.
go for a consult. I have seen how Doc does his consults. He actually digs deeper on what your medications is currently taken, or so there you go. Please do have a consult with Doc Jansen. You can type in how to consult or just click on the link written on the description box and also on the comment section. Thank you, Miss Ria Cordero, for your question. Another question coming from our dear Miss Lily Neo. Doc Jansen, will exercise help to relieve the pain, and what kind of exercise for the joint pain? You've answered this a while ago.
Yes,
So,
resistance exercise. Buy
resistance.
your resistance band. I think Miss Lily has one.
Oh,
I think
yeah, you've
correct,
consulted her
has one.
before.
Yeah.
Thank you,
Resistance exercises. Okay.
Ah, thank you, Doc. Another question coming from Miss Jocelyn de los Lado. Negative naman po ako sa RH factor ko po, pero di nawawala yung pain sa hand. May thyroid nodule din po ako.
Yeah, we have to look into it further, no. However, here's the thing, no. If RF factor is negative, it does not necessarily mean that you don't have rheumatoid arthritis. Okay, because there can be false negative results. Okay, so but of course, if it's negative, then we have to consider other diagnosis. But right on the get-go, if you're feeling pain, definitely anti-inflammatory diet would really help. Okay, so please go for a consult so I can help you better. So I can make the proper recommendations.
Thank you, Doc. Okay, another question coming from Miss Mercy Tulio Kilantang. I am having back pain on and off. I am currently taking vitamin D3 and stop eating animal-based products. What could be the causes of the pain?
There are a lot, no. Number one, musculoskeletal. Where specifically in the back, I have to know as well. So, yeah, better go for a consult so I can make the proper recommendation. Yeah, there are a lot of issues. There are a lot of causes that has to be considered. Okay.
There could be some medications that can be taper off na.
Yes, definitely pain medications you have to take already. Then yeah, and then see if it improves, no. But definitely go for a consult so I can assess properly.
Thank you, Doc. Okay, another question coming from Maria Dolores Laga. Doc, yung kung parang sinusugba sa apoy, yung sugba sa apoy, ang mga kamay, pati mga braso, I think the feeling of flaring, I guess, no? Anong klaseng arthritis po yun? Minsan po pati yung paa ko, pati yung paa po at yung balat ko sa bukong-bukong ko kumakapal.
Well, definitely inflammatory arthritis, pero what kind of inflammatory arthritis, we do not know. I would, depending on the age as well, gout might be one consideration. Rheumatoid arthritis is definitely not ruled out yet, so we have to consider that. What else? Yeah, those are psoriasis, probably, depending if you have skin rashes or what, no. But yeah, those are some of the considerations. But yeah, better go for a consult so I can we can discuss this in more details.
Yes. Seems that we have a lot of factors not to consider and rule out.
Especially for arthritis, because arthritis is a very non-specific symptom. So arthritis can mean a lot of things.
Exactly. Thank you, Doc. She has a follow-up question. Doc, yung santol po ba is isa sa mga triggers po ng inflammation?
Santol, no. Santol, no. Fruits are seldom triggers of inflammation. It's usually the meat products.
Thank you, Doc. Okay, another question. Okay, Miss Cheng, who is in so much pain, di ko matukoy po ano exactly ang sakit ko. Initially, cervical spondylosis. Meron po EMG and CV. Ang nakita ay C5 at L5 left. Pero bakit right ang masakit sa akin? Yung shoulder blade ko.
Might be a different issue. It can also be referred pain. Yung referred pain, yung tinatawag na ang identifiable na nerve na impingement nandito. However, ibang parte ng katawan ang sumakit kasi connected ang nerves nila. That's why. So it can be one.
Iba pa yung frozen shoulder doc dito. No?
Yes, it's different issue pa. However, for this, definitely we have to investigate why. Because yung result ng EMG and CV might be different. It might be a different entity at all na hindi related. Okay? Yeah.
So, better go for consult.
So you have to work out kailangan natin work up yung the shoulder pain.
Yes. I'm very concerned about this kasi sabi niya, she's in so much pain right now.
Yes.
Oh, okay. Miss Bambi from Yanesa is asking how to consult. Go, Beth. Okay, let's have her.
We'll have Beth message you na, or you can email us directly at wecare@simplynature-inc.com or message us at our Facebook page.
Yes. Follow. By the way, guys, please do follow Simply Nature International at the same time Simply Healed Medical Group Facebook pages so that you can always be updated on the upcoming events or online events here in Simply Nature. Okay. All right. Next question coming from is Tata Marilyn Rubio. Question: what triggers acid reflux? Usually after eating and attacks during the night, leading sleepless nights. She's coming from Malta, Europe. Thank you for watching that.
Well, for acid reflux, there are a number of triggers. Number one would be stress. Okay, that is a very common trigger. Number two, of course, food. No? Now, which foods? Number one would be foods that are acidic. First food is soda. Soda is acidic. Okay, so that can trigger acid reflux. Another one would be coffee. Okay. Dairy products can also trigger acid reflux. Meat, because meat is very difficult to digest, so that can also be one trigger. Other ones would be oily or fatty foods. Okay, spicy foods as well. Okay, so if I hit a few that you're eating, you have to avoid those. Okay. Next one would be infection, which is H. pylori infection. Now, for the infection, it can trigger hyperacidity, gastritis. That's why that's the one that's triggering your acid reflux. So if you have one, you actually have to get tested for this inside the hospital. If you have one, then antibiotics would be enough. The antibiotics would kill the infection. Okay, so those are some of the triggers, the more common triggers of acid reflux.
Thank you. She's actually suggesting, Doc, how about next topic, acid reflux now? Why not?
Yeah, why not?
Very
acid
positive.
reflux is actually very common. It's a very common disease.
Thank you for suggesting. Very good. Okay, another question comes from Ms. Jeannie Bandiling. Okay, as a suggestion as well, do a webinar naman po about cervical and lumbar HNP. Please, I really need to understand this disease.
Yes, it's actually very interesting. HNP is herniated pulposus. What's that? That's actually imagine your spine, right? So in between your spine, there's a disc, sort of like a shock absorber. Okay, so for example, this is your bones, no, your spine. So in between your spine, there is a sort of like a cushion. Okay, now that cushion, if you view it like this, okay, there's a center, there's a structure there at the center. That's the nucleus pulposus. Now, HNP is herniated nucleus pulposus. That's the medical term for herniated disc or slip disc. Okay, so that nucleus pulposus actually herniates outward, and the herniation outward, that is the one that impinges the nerve.
And it's painful.
Yeah, that's why it's so painful. The only treatment for that is surgical.
Okay. The sleep disc,
treatment for
that's the one that I think I've heard before. It's quite common term. HMC. Okay, so that's one.
well, physical therapy would be one, the more conservative one, no? Physical therapy, pain management, medications. But that's just trying to mitigate the,
Mhm.
the pain or the condition, try to manage it non-surgically. The definitive treatment for that would be surgery. Okay?
The recovery is quite fast as well.
No. You need physical therapy after surgery because that's spine. That's your
Okay.
spine. Okay. So yeah, it's not as simple as it's not as simple. But definitely, what the surgeons are advocating now is that once they have operated on you, physical therapy has to happen immediately so that you can recover much faster. Okay.
Thank you, Doc. See, there's a lot of takeaways on this question. Thank you, thank you. Thank you, Miss Jeannie, as well for asking this question. Okay, another question from our dear Lily. I have experienced trigger finger and twisted finger, which are very painful. Is this a sign of arthritis, and what causes this situation? You have to
It
prevent
can,
from happening.
it can be, no? Because for trigger finger, there is a ligament here that actually helps you bend your finger. And that ligament sometimes is inflamed. That's why you have sometimes your finger just involuntarily, goes bends.
Twitching.
And it's very difficult to put back. Okay, yeah, because of the inflammation and the spasm. One treatment for that would, of course, again, be your pain relievers, anti-inflammation, anti-inflammatory foods, nutrients, and if it's really severe, the surgeon can actually release that ligament.
Nice. Okay. All right. Another question coming from. Just a second. Next topic, acid reflux. Okay. Thank you for the explanation coming from Miss Christine. Welcome po. Thank you, thank you. Miss Bambi is asking, does meat include poultry as trigger of inflammation?
Poultry, it can.
Okay. Can. Oh. Others are saying thank you so much, Doc, for the very good explanation. So I think we have answered actually quite all the questions for tonight, Doc.
Oh, that's good.
Wow. That's very good. And it's also about time. Thank you. Once again, thank you so much for all your questions that you have sent to us. If you still have questions, please do send out maybe not on the comment section or just maybe send it out through the messenger. Okay, may humabol, Doc. Sorry. Okay, coming from Ms. Emma Aguilar, is there a role for collagen and glutamine supplementation?
Yes. Collagen can help, actually. Yeah, I have seen patients who are taking collagen supplements that have reduced the amount of pain that they are experiencing. Definitely collagen can help. However, if you are trying to source collagen from natural sources, please don't, because most collagen are sourced from marine sources. Okay, the marine sources, if you eat them, those are the ones that can cause inflammation. Okay, so just take the supplement. Okay? At least it's the collagen has been isolated on you. Okay.
Thank you so much, Doc. Okay, Doc, of course, before we say goodbye to our viewers, I'd like to hear, could you please give them a very quick parting words? Because as you know, we have medical practitioners tonight, patients, and caregivers who are experiencing RH, or RA, sorry.
Yeah, so once again, I would like to thank all of you who have stayed until this late at night and who have asked very wonderful questions. I'm also learning from the questions that you're asking. Okay, so it's weird, no? The doctor learning from those who are asking questions. Yes, because I have to research the questions that you're asking. Okay, so I read more and I know more, no? And in that way, I can also help you much better. So I can point you to the right information. So once again, I would like to thank all of you for staying and for watching. Please share these webinars, no? Share these to your loved ones, especially those who are really in need of medical intervention, or those patients who are who have a lot of questions and their doctors or their doctor's appointments is just so short. They can ask their questions. So refer. This is the proper channel to do that. Okay. So yeah, please share our webinars. No, it's always it's every Thursday. Okay. Next week, what are we discussing next week? It's
Next week, July 13.
is a patient of mine. No? It's another case presentation. So here we will discuss, does sugar really feed cancer cells? Right? Diabetes is high blood sugar, right? Yeah.
Yes.
So we'll answer that question in the next webinar. So if you know someone who has cancer, share this video to them. Ask them to come. Okay, invite them.
Doc. Once again, I'm sure that on behalf of our viewers for tonight, thank you so much, Doc, for answering all our questions and for always being there to empower our patients out there in resolving their health issues. Thank you so much, Doc. So once again, I just want to to invite everybody to join our webinar. That's share this with your fellow patients in your hospitals and also even with your doctors too. Please do so. Okay, they are very much welcome to also watch our webinars. Okay, also please don't forget. I'm sure a lot of you are excited because tomorrow is 7/7 and we will be having our Lazada live here in our shop or Lazmall shop. That's why once again, no, we are not only in Lazada, but we are in Lazmall. That means when you place an order via Lazada, it's actually what you're getting is a legit and authentic Simply Nature Bars products. Okay, there you go. Thank you so much once again. Your victories over your health illness, whether it's cancer or metabolic illness, is what keeps us going here in Simply Nature. And of course, we wish to see you once again in our next webinars to come, because here in Simply Nature, we are always with you from start to healing. Thank you, everybody. Good night, and God bless you all.